Hey guys, welcome back to my channel. It's your girl Pauline. I am in the car driving. Sorry about that. I'm headed to the Erin Condren store. Yes, I found out that there's an Erin Condren store in my area. And I have to do that. I have to get my nails done because I took my nails off. My new job does not allow nurses to have acrylic nails or tips on, so I got to come up with some sort of other option. So yeah, so we're out and about today, and I wanted to bring you guys with me. Actually, not really a vlog. I just wanted to talk to you guys about this whole coronavirus situation and being a new nurse in a new area. It's some getting used to how people do things. I've only worked in one facility as a nurse, and now I'm in a new facility, so they're doing things a little different. And there's a few things that I want to talk about that are kind of different to me. And I've never been a nurse in a public health or a pandemic situation, so let's put that out there. So this may have happened before, and I just have not been, I just did not know about it, or it just did not affect me because I was not in the nursing field. So number one, the first thing is coronavirus in general. In general, it's the coronavirus. It's a respiratory virus that attacks your respiratory system. It causes fever. It causes shortness of breath. Trouble breathing pretty much is going to do. It's virus. So it's a viral situation. So there's no medication that you can take that's going to stop it from happening. As opposed to a bacterial infection where you can take an antibiotic and it's going to kill the bacteria. No, this is a viral situation, so it has to run its course, just like the common cold, just like the flu. But what they can do for a person that's affected by corona is treat the symptoms. Okay, so that's the first thing. Coronavirus, we know what it is. We know what it's going to do to us. Also about the coronavirus, the incubation period is also the most important of it as well. They're saying that the incubation period for corona is 2 to 14 days. Yes, 2 to 14 days. So that means that if you come in contact with someone that has had or it has the coronavirus, within 2 to 14 days, you will see some sort of respiratory symptoms. You'll have a cough, you'll have a fever, you'll have shortness of breath, whatever. 2 to 14 days, okay? That's the second thing. Let's use that as number 2. Number 3 is that we as healthcare professionals are highlighting individuals that have traveled outside of the country, because corona is not a U.S. created virus. This is a virus that started over in Wuhan, China. And because of that, there are persons that have traveled to that area who are, going from Wuhan to here. Why is there so much traffic? Oh my God, I'm never going to be able to get home. Anyway, there are persons that have traveled, to that area. There are persons that may have traveled to other areas. Anyway, all the people that were in the area of Wuhan when this virus started has disseminated to different parts of the world and took this virus with them. At the time of their separation, they may not have experienced any symptoms of corona, but hence there is a 2 to 14 day incubation period. So corona did not have a chance to show its presence in some of these individuals, and now they have taken the corona all over the world. So in the United States alone, as of today, I think that there are just 22 deaths which is something that should not have happened, but it has happened, unfortunately. So number 4, now that we know what the coronavirus is, how it presents, the incubation period, and this travel screening, healthcare professionals, when someone comes to the hospital, presents with whatever symptoms, whatever issues, no matter what, we're asking them questions like, have you traveled out of the country? This has been going on for years. This is nothing new. If they have traveled out of the country recently, then we will be on alert to the areas that they have traveled to and the symptoms that they currently present with. This is what's going to narrow down whether we suspect corona or not. Now, as a new nurse in my facility, a few things are happening. Nurses are wearing masks, surgical masks, everywhere they go. It doesn't even matter if they are in contact. There's not even a corona person in my hospital, but people are scared. People don't want this thing, so they're wearing masks everywhere in the hospital. The cafeteria workers wear masks. The housekeepers wear masks walking the halls of the hospital. So a housekeeper and dietary person that I spoke to, both of them, they are going to use masks when they go in the room and dispose of them, which is the proper thing to do, because I'm not going to hold on to a mask all day long. That's not good, especially if you're going into an isolation room and then you go to another room that's not isolation. Now I have taken the germs from one room to the next room. That's what I'm thinking. I'm thinking that if you keep the same mask on, you taking germs around with you. That's just what I'm thinking. So they get new masks. So now there is a mask shortage in the hospital, and people are taking masks from any place that they see masks, because guess what? They're not taking no chances. They are not going to let COVID-19 enter into their body system and take them out, honey. So they are stealing masks. They're taking masks home for their family. They're stocking masks. They're hoarding them. So now brings me to the next thing, and I don't know what number we're on. I think 6, but I don't know. The management and administration have locked up the masks. The masks are locked. So now, when you normally would have had an isolation room with an isolation caddy that had masks and gowns and everything in there, and that's not happening now. Now you got to go to the med room. And when you go to the med room, it's locked, so only certain people have access. You guys know that. So you go to the med room and get a mask, and you got to keep doing that. The masks aren't going to be out. I personally think that's a safety hazard. In my opinion, it's a hazard. Because let's say I have a patient that is on droplet precautions who has a emergency situation. Now I got to go. Oh, I'm going the wrong way. I have a person that has an emergency situation. Now I got to go and find a mask. And that ain't cool. I'm not trying to find no mask. I feel like the mask need to be by the door. I understand the situation, but, there are drawers by some of the... excuse me. There are drawers by some of the rooms. You can put the mask in the drawer. I don't know. Hold on a minute. Anyway, you can put masks in the drawers, and then that way only people that work there are going to know the mask in the drawer unless somebody actually sees you go get the mask. But anyway, that's not how they want to do it. They want to lock the mask up. Okay, fine. But I'm going to keep a mask in my pocket, a new mask, because I'm not going to find myself in an emergency situation and I can't get to no mask. Anyway, that's that. So the final thing I want to say, well, all around it's a shortage. It's a shortage of everything. Next thing is these people going to the grocery store. They're buying bleach. They're buying toilet tissue. I mean, they're buying sanitizers out. There's none to be found anywhere. Mind you, you got to get some sanitizer. Now, I have in my car, I'll show you guys here in my thing, I have a bottle of sanitizer from the Dollar Tree. I've used this sanitizer since I had this car. I just got this car October. Look at where, let's see if I can get you. See where I'm at? Okay. And I always use this sanitizer. I put I'll go to the store or I'll come home. I'll use a little bit of sanitizer coming out of the store. Eat before I eat if I've got food, whatever the case may be. I try my hardest not to touch my food. When I eat it, I get it in a wrapper and I use the wrapper to touch it, whatever. Now you can't touch your face. Can't touch your face. You can't go to the grocery store and get toilet tissue and bleach because all of it's gone. Everybody done got all of it. I watched a video this morning of some people fighting at the store over toilet tissue. It's crazy. It's bananas. So people are going ballistic, and it's sad. And it's so sad. And I am so saddened by the response from us of this situation. Because more people die from the flu. More people die from sexually transmitted diseases. We do not protect ourselves from those things the way that we are trying to protect ourselves from COVID-19. It is unbelievable the response that the public has given to COVID-19. And I think it's because of the mortality rate. The amount of people that have died from it is scary to some people. They don't know if they're going to be able to get past it if they get it. So I understand that. So yeah, finally, if you believe that you have come in contact with someone who has developed COVID-19, which, they probably don't even know they got COVID-19, but if you know, and it's a confirmed diagnosis that this person has had COVID-19 and you have come in contact with them, it is your responsibility to self-quarantine. Okay, what is self-quarantine? Self-quarantine is you taking it upon yourself to separate from others for a time period of 14 days. Remember, the incubation period of COVID-19 is 2 to 14 days. So, if you separate yourself for 14 days, and on that 14th, 15th day, give or take 1 or 2, you have not experienced any symptoms to COVID-19, that means you're good to go. You're free and clear. Okay? Now, my question is, I take that free and clear and I go outside and then I come in contact with somebody else that has COVID-19 and then I get it. Or did I come in contact and I self-quarantine, my body build antibodies against COVID, now I'm immune. Like, how does this work? What is this self-quarantining doing? What's happening in my body? I want to know. Yeah. So we don't know that yet, but some people have presented with respiratory symptoms that have been slight. They will give them medications for those symptoms and they get better. Their immune system is stronger and they get better. So we have to build up our immune system. Vitamin C does that. Vitamin C builds up our immune system, so we would really want to take in as much vitamin C as we can. Get some tablets, supplements, food, dietary options. I got these little vitamin C drops from they were $1 for a bag of like 20. So yeah, I've been sucking on them suckers. They good too. They grapefruit, lemon, and I think they just grapefruit, lemon, and orange taste. And I've been sucking on them things. They good. Anyway, but I just want to let you guys know we have worse things out here than COVID-19. So don't go fighting people like on Black Friday for household items. Take care of yourself. Wash your hands before you eat. Don't touch your face, because germs get in your face through your eye, your nose, and your mouth. So do not touch your face till you wash your hands. If you come in contact with someone that has COVID, they're coughing or they're sneezing, and they're putting little droplets of snot and water out in the air or on different surfaces, and you come and you touch those surfaces, or you're in the air and it gets on you, as long as it's not able to enter into your body. So it could get in your face. If somebody coughs in your face, you got it on your face. As long as it doesn't enter into your body, you're fine. So we want to make sure we're taking, our hygiene is important. We're taking baths daily, all that good stuff. So yeah, that is it. I have nothing else to say about this COVID-19. I am just, as a new nurse, this is the first time I've ever had to work this kind of situation in a hospital, and it's very interesting of how things are going. So yeah, just take care of yourself, everyone. Remember that you are important, and I will catch you guys in the next video. Let me know topics you want to hear from a new nurse. I'm going to be doing a Q&A soon. A new nurse Q&A is what I'm going to do, because I think we need, I think you guys have some questions that need to be answered about this whole after nurses school. So yeah, thank you for watching, and I will see you in the next one. Peace.